If you're peeing more often since starting tirzepatide, you're probably wondering if that's normal or something to worry about. Let's break down what might be happening and when you should reach out to your doctor. First, it's important to know that increased urination isn't actually listed as a typical direct side effect of tirzepatide in the FDA prescribing information, but some patients do report it. So what's going on? There are actually several possible explanations. If you're taking tirzepatide for type 2 diabetes or weight management, it works by lowering your blood sugar levels. Here's the interesting part. Before treatment, high blood sugar can actually make you pee more because excess glucose spills into your urine. As tirzepatide improves your blood sugar control, that glucose-induced urination typically decreases rather than increases. Another factor is weight loss. When you start losing weight, especially in the early stages, your body releases water that was stored with glycogen. This can temporarily increase how often you need to pee, but this effect usually doesn't last long. Sometimes the culprit isn't tirzepatide at all. If you're taking other medications, especially SGLT2 inhibitors or diuretics, those are designed to increase urination. It's easy to attribute the symptom to your newest medication when it might actually be something you've been taking all along. And don't overlook the simple stuff. Many people increase their water intake when they start a weight management program. More water in means more water out. So when should you actually be concerned? Contact your healthcare provider right away if you notice any of these warning signs. If you have painful or burning urination, fever, or back or flank pain, these could signal a urinary tract infection. People with diabetes have a higher risk of UTIs, so it's important to catch them early. Also, reach out if you experience severe abdominal pain, signs of dehydration like extreme thirst or dizziness, or symptoms of diabetic ketoacidosis. Watch for very dark or foamy urine, which might suggest kidney issues. And if you notice swelling in your legs or feet, or if you're actually urinating less despite drinking fluids, that's worth checking out too. If you're experiencing frequent urination on tirzepatide, here's what you can discuss with your doctor. They might review all your medications to see if something else is causing it. They can check your blood sugar levels to make sure they're in a healthy range, and they can assess whether you might have an underlying condition that needs attention. Your healthcare provider will likely want to monitor you regularly anyway. This typically includes checking your hemoglobin A1C every 3 to 6 months and assessing your kidney function annually. These routine checks help catch any issues early. Managing this symptom is usually pretty straightforward. Stay hydrated, but you don't need to overdo it. Keep track of when you're urinating more and what else is happening, like what you're eating or drinking. This information can be really helpful for your doctor. Here's what to remember. Increased urination on tirzepatide isn't a typical direct side effect of the medication itself. It's more often related to improved blood sugar control, temporary fluid shifts from weight loss, other medications you're taking, or changes in how much water you're drinking. Most of the time, it's not a cause for concern, but if you're experiencing any of those warning signs we talked about, don't wait to contact your healthcare provider. Every person responds to medication differently. What you're experiencing might be completely normal for you, or it might need some adjustment to your treatment plan. That's a conversation only you and your doctor can have. This video is for educational purposes only and doesn't replace personalized medical advice from your healthcare professional. Always speak with your doctor about any symptoms or concerns you have while taking tirzepatide. Have you noticed changes in urination on tirzepatide? Drop a comment and let us know your experience. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.